Although thousands of chin and other implants are placed in the body without complications, complications can and do occur. There are also potential complications with the alternative means of enhancing the chin, as previously discussed.
If you are watching this video, you may have already considered the alternatives to having surgery to change the appearance of your chin. In most cases, this surgery is elective, and you do not have to have the procedure and be subjected to the risks. You should consult with your doctor about available alternatives other than a surgical procedure on your chin. Even in the best hands, adverse events can occur. Always consider that you could be the one having the complication. Bleeding and infection are possible with any surgical procedure. Although rare with chin implantation, they do occur. If the implant becomes infected, it usually must be removed indefinitely to let the infection resolve and then can be replaced. The degree of scarring is always unpredictable and can be more noticeable than we would like. Incisions inside the mouth may not be visible, but unusual scarring could occur. Healing is also unpredictable, and rarely, pain and swelling can persist in the area where the implant was placed. No two sides of the face look alike. Very careful evaluation of the jaw will often reveal differences in projection. Implants may not be able to correct these asymmetries. Implants may also be placed off-center, which is called malposition. This can lead to more noticeable asymmetry. Although the implants typically become fixed, stable, and immobile after the healing period, they could be moved through trauma. This usually would require a force that might even break your bone. If your chin implant is synthetic or alloplastic, your body will form scar tissue around it. There is a chance the scar tissue can tighten around the implant and cause pain and distortion. The risk of connective tissue diseases from these implants has not been proven medically and would be extremely unlikely. The chin implant will be placed in an area where the nerves to your lower lip run. Although usually temporary and infrequent, damage to these nerves can cause permanent numbness or an inability to normally move the lower lip. Although chin implant surgery is generally very straightforward, it is surgery. Any surgery can result in other complications, permanent deformities, and the need for revisional surgery. Anesthesia complications are rare but do occur. Death and the need for hospitalization have been reported. Related financial obligations and considerations should be discussed in advance with your surgeon. Chin augmentation surgery is safely and frequently performed under both local and general anesthesia. With a general anesthesia, you are completely asleep and your breathing is controlled by the anesthesia provider. Under local anesthesia, usually you are sedated, and the areas to be operated on are made numb with a series of injections. The operating room time varies, but typically it is a relatively short time. Post-operative instructions vary among surgeons and should be followed carefully for the best chance for an ideal outcome. It is important not to put pressure or external forces on the chin for 4 to 6 weeks after healing to decrease the likelihood of moving the implant or causing malposition. Be sure to show up for all your scheduled post-operative appointments so your doctor can evaluate your healing process and identify any problems early if they occur. Although possibly still swollen, patients should be able to interact publicly in 5 to 7 days. Discomfort is usually easily controlled with ice and oral pain medication. Final results are often not visible for several months when all the swelling is gone.